Hello friends, welcome to Radiology Insights, NEET SS and FRCR version. In this we are going to learn today about the rib lesions. So rib lesions can will include the rib notchings. We should know about the rib notchings. Then we should know about benign rib lesions and malignant rib lesions, which we will learn in this lecture. So rib notchings. This is called as rib notching. That is this irregularity in the rib is called as rib notching. This can be superior. If it occurs on the superior aspect of the rib, then we call it as superior rib notching. If it occurs in the inferior aspect of the rib, then we call it as inferior rib notching. So superior rib notching occurs in connective tissue disorders such as rheumatoid arthritis or SLE, Sjogren's syndrome or scleroderma. Superior rib notching can also occur in metabolic hyperparathyroidism, metabolic disorders like hyperparathyroidism or miscellaneous lesions like neurofibromatosis, restrictive lung disease, poliomyelitis, Marfan syndrome, osteogenesis imperfecta, and progeria. So connective tissue disorders, metabolic and miscellaneous disorders mainly includes the superior rib notching, whereas inferior rib notching mainly occurs in arterial venous or arteriovenous malformations. Mainly the lesions related to vessels will result in inferior rib notching. Actually, whenever there is enlarged or dilated vessels, these enlarged or dilated vessels will cause impression on the ribs. And when they cause impression on the adjacent ribs, this results in rib notching. So there can be arterial causes like coarctation of aorta, aortic thrombosis, subclavian obstruction, or any causes of pulmonary oligemia, or venous causes like superior vena cava obstruction, arteriovenous malformations like pulmonary arteriovenous malformations and chest wall malformations, and neurogenic conditions like neurofibromatosis, especially ribbon ribs. These are the most common causes of inferior rib notching. So remembering superior and inferior rib notching is very important for the exams. So if you have to remember, just remember anything related to arterial, arteriovenous or blood vessels along with neurofibromatosis will result in inferior rib notching. Anything related to connective tissue disorders and all disorders of the bones like connective tissue disorders and metabolic disorders, especially those which you will learn in MSK, most of them result in superior rib notching, like rheumatoid arthritis, SLE, Sjogren's syndrome, metabolic disorders like hyperparathyroidism, miscellaneous disorders like neurofibromatosis, restrictive lung diseases, poliomyelitis, Marfan syndrome, and osteogenesis imperfecta and progeria. So remembering this table is very important, especially if you remember this one thing that any arterial venous or arteriovenous anomalies or malformations along with neurogenic will result in inferior rib notching, whereas connective tissue disorders with some miscellaneous disorders and hyperparathyroidism metabolic disorders will result in superior rib notching. Thank you for watching. advancing.